I'm Shani Wilson-Smith from EFM Health Clubs. I'm the franchisee from EFM West Lakes, and I'm here today to talk to you about blood pressure. Now, blood pressure is one of those things that we've all heard the term, but a lot of us don't actually know what it is. So what blood pressure is looking at is the pressure in the blood vessels in your entire body. There's two numbers in blood pressure, which you've probably seen them written down before, but you may not know what the two numbers are. The first one at the top is called systolic, and that's the pressure in your blood vessels when your heart beats. The second one, the bottom number, is called diastolic, and that's the pressure in your blood vessels when your heart relaxes, so in between beats. And those are the numbers that we look at in your blood pressure. So, what we're specifically looking at today is high blood pressure, or otherwise known as hypertension, is the other word that you may have heard for it. Now, it's thought that about 30% of Australians suffer from high blood pressure. About half of those are undiagnosed, and that's one of the problems with blood pressure, is that you can have very high blood pressure and have almost no symptoms, which means you can be at great risk and not know it, so worth getting it checked out. So what's a healthy blood pressure? If we have a look, you can see over here, our top numbers. A healthy blood pressure is looking at 120 over 80 or lower than those numbers. High blood pressure is determined as being 140 over 90 or higher. If you're somewhere in the middle, we describe you as having borderline hypertension. So you're not quite there yet, and we'd love to see you go the other way, we'd love to see you go down. So what are the risks of blood pressure? Well, the risk of blood pressure is that every one of the blood vessels in your body is under increased pressure if your blood pressure is high, which means those blood vessels in your brain, the blood vessels in your kidney, in your heart, all of those are under greater stress. We don't want that to be the case. So, of course, the side effects, the potential risks of things like heart attack and stroke and kidney damage are just some of the potentials for high blood pressure. What are the risk factors for you? If you're someone who's thinking that maybe you've got high blood pressure, some of the risk factors are being overweight, being a smoker, having high cholesterol and having diabetes all increase the likelihood that you will also have high blood pressure. If any of those ring bells, better go into your doctor and get it checked out. So how do we improve it? What are the ways that we can improve your blood pressure? Obviously, quit smoking. That's a good rule of thumb. Quit smoking, everybody. Alcohol is another one of the ways, so reducing your alcohol intake, which means for men we're looking at 2 serves or less a day, and for women 1 serve or less a day is to keep you in a healthy range with a couple of alcohol-free days a week, people. Body weight, so we want to keep your body weight in a healthy place. That will help to keep your blood pressure under control, and particularly weight around the midsection. Sodium is another one of the places that we're looking, so salt in your diet. Sodium is another word for salt. So what we consider a low salt diet would be about 2,300 milligrams a day. Now put that in context, the average Australian takes in about 9,000 milligrams a day at the moment. So you can see that we're tending to be a bit high on the sodium intake. If you're looking at your labels on your food, the thing we want to look for a low salt food is under 120 milligrams per 100 grams, so percentage under 120. And for the sodium to be high is over 500 milligrams per 100 grams of your food. Now, last and not least is, of course, exercise. And the best way to deal with blood pressure is to keep a healthy diet and to keep your activity level up, because that will also help to keep your cholesterol in the right place, keep your body weight in the right place, and make you feel better all in all. So people, get down to your EFM, get exercising and get your blood pressure to a healthy place. See ya.